Good morning. It's so nice. It's truly an honor and a pleasure to be with all of you this morning. So Leadership for Healthy Communities has been really busy this past year thinking about the big picture. We all know that we have a childhood obesity crisis of epidemic proportions, and we all know we have a national imperative to create schools and communities that can support healthier children and families. And we understand that it'll take powerful forces in the public, nonprofit, philanthropic, and private sectors to create environmental and policy changes that provide children and their families with more healthy options. We also know that we have a growing movement of incredible, committed policymakers, advocates, school and community leaders, and funders across the nation that are already deeply committed to doing what they can to reverse this epidemic that so terribly threatens the health and well-being of our children. Given these factors, the challenge has been to figure out what we can do to really expand the number of elected and appointed officials willing to leverage their power to adopt and implement policies that can make a difference for the health of our children. Given the unique role that Leadership for Healthy Communities plays in working with policymakers, the focus has been on building national political will by identifying and cultivating an army of state and local elected and appointed officials, a few good men and women, if you will, who can serve as champions for healthy communities. So in pursuit of this goal, this morning's breakfast gathering really serves as a launch pad for LHC's Action Strategies for Healthy Communities initiative. This multi-level initiative includes the rollout of our Action Strategies for Healthy Communities web-based toolkit. This toolkit contains 10 strategies that can help reverse the childhood obesity epidemic, many of them supported by a growing body of evidence that state and local elected and appointed officials can deploy in schools and communities. The second phase of this initiative will be rolled out through a forthcoming call for proposal in the next month or so. We'll also seek to use or continue to use peer-to-peer strategies to get policymakers to recruit their colleagues to join the Healthy Communities movement, to use the toolkit and other resources to provide the technical assistance to leaders in targeted geographic areas in our nation most overburdened by the childhood obesity epidemic. We're incredibly proud that this toolkit was developed in close collaboration with 11 powerful policymaker organizations that all are grantees under Leadership for Healthy Communities. We're particularly excited that this resource includes a unanimous endorsement signed by the executive directors of each of these 11 policymaker organizations. This leadership statement really underscores each organization's recognition of the national problem posed by childhood obesity and the critical importance of working collaboratively across multiple levels of government to support healthy kids and healthy communities. So in a few minutes, you'll hear more about the urgency of the need for collective action, as well as more about how one community has implemented many of these strategies. But before we go there, I'd like to take a few moments to recognize 3 groups of folks whose contributions have been critically important to the work of healthy kids, of Leadership for Healthy Communities. So when I call your name, if you'd be kind enough to stand, and please remain standing, and if we could hold our applause to the end. And I'm going to apologize in advance. I practiced pronouncing each of your names, so I hope I don't botch any of them. So without further ado, again, we'd like to recognize the leadership of these organizations as well as the staff within these organizations. Firstly, Executive Director Danielle Dominich of the American Association of School Administrators, and the staff as well, and please remain standing. Executive Director Brenda Welburn of the National Association of State Boards of Education. Executive Director Ann Bryant of the National School Board Association. Elizabeth Couts, Second Vice President, U.S. Conference of Mayors. Kathy Novak, President, National League of Cities. Cynthia Mathis Morris, Board of Directors, National Association of Latino Elected and Appointed Officials. William Pound, Executive Director, National Conference of State Legislatures. David Atkins, Executive Director, Council of State Governments. Elizabeth Keller, International City County Management Association. Judy Corbett, Local Government Commission, Executive Director. And finally, Larry Nake, President, National Association of Counties. Would you all join me in giving a warm applause to all of these leaders? Thank you so much. We'd also like to recognize our National Advisory Council members. Would you please stand and remain standing, and we'll hold applause. Dr. Lynn Kathleen, Martha Katz, and Dr. Erin McDougall. Please join me in thanking them for their generous contributions and commitment. Thank you. At this time, it's my distinct honor to introduce to you Angela Glover Blackwell, the founder and Chief Executive Officer of PolicyLink. PolicyLink is a research and action institute well known nationally for its leadership and advocacy to improve the health and well-being of Americans, especially those in lower income communities and communities of color. A renowned community building activist and advocate, Angela formerly served as Senior Vice President of the Rockefeller Foundation. A lawyer by training, she gained national recognition as founder of the Oakland Urban Strategies Council, where she pioneered new approaches to neighborhood revitalization. Please join me in welcoming Angela Glover Blackwell.